just a little bit of advice. In these heat waves that we're having, nobody, and I mean nobody, wants to hear you say, "Hey, hot enough for you?" Hey there, folks. Welcome to another FTP from the pit fast track. Evidence-based, no polish, no pretense. And remember, I am an emergency medicine physician assistant. I am not your physician assistant. So, yeah, so we're dealing with some hot stuff, some hot temps, some heat waves here, particularly here on the East Coast. And I thought, might be a good time to kind of go over heat emergencies. So, and to kind of start off with the it's important to know that when we talk about heat exhaustion and heat stroke, it really is kind of a spectrum, and people can go from heat exhaustion to heat stroke very quickly and suddenly, and you don't have to. You can go right into heat stroke without even dealing with the heat exhaustion point. One key factor that really kind of differentiates the two is an altered mental status. People who have heat stroke are going to have an altered mental status. And it also used to be taught that with heat exhaustion, you would have sweating, and with heat stroke, you would have no sweating. And that's not entirely true, as we will see. So when we're talking about heat exhaustion, we're typically talking about symptoms such as fatigue, weakness, headache, nausea, dizziness, and a lot of increased thirst, which I guess kind of makes sense. Body temperatures can go from 100.4 degrees to up to 104 degrees, but the patient's mental status, a person's mental status, really much stays intact. Primarily due to fluid and electrolyte loss from heat exposure. These patients, most of them will have a lot of heavy sweating, hot red skin. In this scenario, you still have some wiggle room, and a lot of times you can treat this by removing oneself from the sun, from the heat, into a cooler room, a room with lots of fans to kind of help with blowing off a lot of that excess heat, ice packs, and removing of clothing, and then hydrate. But you do have to stay vigilant, because this again can progress to heat stroke. So you have to stay vigilant for any changes in mental status, or if you cannot tolerate PO fluids, if you're vomiting stuff and you can't keep fluids down, then you need some extra help in that regard as well. Now with heat stroke, that kind of changes. That's a different ballgame, and this is a life-threatening emergency. Patient's body temperature can get over 104 degrees Fahrenheit, and it is combined with an altered mental status, confusion, delirium, seizures, combativeness, slurred speech, and even entering into a coma. This is also commonly associated with a lot of electrolyte disturbances, renal failure, being primarily one of them, and this has a high rate of mortality. Mortality in this, death rates can occur up to 80% without treatment. And like I said before, this is where the whole sweating, non-sweating thing kind of falls apart. In exertional heat stroke, which is typically with younger people, they can still have a lot of profuse sweating, but in classic heat stroke, a lot of people can have hot, dry skin in that scenario. So again, it doesn't really differentiate right off the bat between heat exhaustion and heat stroke. This is something you need to go right to the ER. This is going to require very aggressive treatment, usually whole body, cold water immersion, IV fluids, labs to assess for the level of organ failure, and a lot of times these patients are getting admitted to the ICU. And finally, it's important to note that certain patient populations are going to be at higher risk for this. Number one, extremes of ages. The very old and the very young are going to be more susceptible to this. Older people have impaired thermoregulation, they have comorbidities, they're on medications, and infants also can have trouble maintaining their body temperatures. People with chronic medical conditions, heart disease, diabetes, renal disease, obesity, dementia, mental illness. These are all people who are going to be at risk or higher risk for these types of heat emergencies. We mentioned medications in the elderly, but anyone who's on medications such as diuretics, anticholinergic medications like Benadryl, beta blockers, calcium channel blockers, which are common medications for hypertension. Certainly illegal drugs such as amphetamines and cocaine. These will put you at higher risk. Occupational and occupational exposures, or people who work outdoors, military, athletes are going to be at higher risk, particularly if they are unclimatized, or if they are deconditioned like me, or wearing heavy protective equipment. And then finally, social determinants, people of low economic status, unfortunately, social isolation, lack of access to air conditioning, marginalized groups, housing without adequate cooling. These are, again, higher risk. So I think that about covers it all here. Well, no, it doesn't cover it all, but it's kind of, the basics, the overview. And just remember, protect yourself, protect your crew, and I'll see you in the pit.